Hello and welcome to episode 4 of Mindset Matters. This week I'm joined by Cork GP Dr. Sarah Fitzgibbon. Sarah was diagnosed with stage 4 colorectal cancer in 2014. Sarah has defied the odds, medical and otherwise. Here's Sarah's story. Okay, Sarah, welcome to Mindset Matters. Thank you for joining me. We'll start off. Tell me about yourself. So for listeners who might not be familiar with Dr. Sarah Fitzgibbon and your story.
Yeah, thanks, Ciara. I'm Sarah Fitzgibbon. I'm from Cork. As most Cork people know, that's the most important thing about them. And I have been a GP in Cork since 2006. And I have been involved in lots of different things over the years since I qualified as a GP. But I suppose the most significant thing that has happened to me over the last number of years was that in 2014 I was diagnosed with stage 4 colorectal cancer, bowel cancer. And I guess that changed the trajectory of my life and my career quite significantly. It was quite a serious diagnosis to get. I was 37 at that stage, so I was kind of, I suppose, beginning to start the sweet point of my career, as you might call it. I was a partner in general practice, and I thought my life was going one way, and then it changed quite dramatically. So a lot of the things that have happened to me in the last 10 years are related to having had this serious illness, serious diagnosis in the background all the time.
Okay, and so what does your life look like? I mean, what did it look like before diagnosis and what does it look like now?
At the time that I was diagnosed, which was November 2014, my youngest daughter was 8 months old. So I had been out on maternity leave and I had just gone back to work about 2 months when I was diagnosed. So I had 3 small children. My eldest was 6 and my little boy was 4. So for anybody who's had the experience of having 3 small children, they know that their life is almost indescribable in its chaos. So even when I tried to look back at it at that stage, and I think what my life was like, it was busy running around the place, picking children up from creche, trying to get everything sorted, trying to have a work life. So it was pretty busy and possibly chaotic at times. And I guess what happened when I was diagnosed was that everything kind of stopped a little bit. So the focus that had been there in terms of getting all of these things done changed a little bit. Obviously, the children still had to be looked after, but at that point, I did stop working for a few months, for 3 or 4 months. And I guess there was quite a significant reset in my priorities, in how I was looking at things. And I was lucky enough that I was able to work most of the time while I was going through treatment. So initially I would have had quite active treatment in terms of chemotherapy and different types of specialist radiotherapy and surgeries. But maybe because I was self-employed and had really good support from my work colleagues, I was able to dip in and out of work. So I was able to continue working when it suited me. So, and sometimes I wasn't able to see patients face to face because of infection risk, but I'd be able to do other things. So again, I was able to, I suppose, to use that slight cliche in terms of pivoting, I was able to change things around a little bit so that I was able to continue to work in the job that I really enjoyed and really loved doing. And then over time, again, things changed over time. I was able to stop active treatment because I responded very well to the treatment. And I was able to do a little bit more education. Doctors are often, they can't stop doing, exams and learning. It's kind of built into us. And so I would have done various different postgraduate courses in terms of leadership, in terms of clinical education, various bits and pieces. But then in 2021, I changed tack in that I started working for the National Screening Service with the HSE, which meant that I was doing less clinical work. So I wasn't working with patients as much. I was still working with them 1 day a week, but I was going more into the sort of, I suppose, policy space, working with a national program rather than just with my own cohort of patients. And then last year, I got bad news in the sense that my cancer had come back again and required treatment again. And then I stopped all my clinical work. So at the moment, I work 3 days a week in, as I say, what might be called a desk job. So I'm working from home most of the time. I do travel once or twice a month, but I'm at home a lot. And it's quite different because I'm not seeing patients like I would have. So that's a fairly significant change for me, but it works really well for the way things are at the moment. It suits how I need my life to be in order to be able to continue with my treatment. Obviously, my kids are a good bit older now. Teenagers are close to it. And I'm more of a scaffolding for them rather than having to do everything for them, which is a change.
Of course, yeah. And Sarah, just to go back to the initial diagnosis, where does the mind go when you get a diagnosis like that?
I think that varies quite a lot. And understandably, for most people, especially when you get a diagnosis of stage 4 cancer, which is technically a terminal diagnosis, so nobody goes from having stage 4 to stage 1 or 2 or 3 once you've had stage 4, which means that your cancer has metastasized, that it has moved to somewhere else. In my case, it had moved to my liver. And traditionally, that would mean that your life expectancy was very short. So around the time that I was diagnosed, or maybe in the decade before that, for most people who were diagnosed with stage 4 colorectal cancer, their life expectancy was around about 15 months from the time of diagnosis. And for a lot of people, obviously, that's devastating. And it can seem inevitable. Only fewer than 1 in 10 people would live for longer than 5 years with the diagnosis like that. And as I say, more than half of people would die within sort of 15 months, 12 to 15 months. So that can be almost impossible for somebody to get their head around that. They can think about, how they're going to leave their families behind, leave their children behind. And that's incredibly difficult to think about. I chose a slightly different path of complete denial. Just decided that wasn't going to happen because it didn't suit my brain. I wasn't able to go there. My family, my mother's family, had a lot of different types of cancer in it with younger people. And I suppose there had been a number of different sort of tragedies. And I said to my mother at the time that I was telling her about the diagnosis, I said, well, that's not going to happen for me. I had absolutely no reason in the world to say that. There is no medical evidence to say that a, inverted commas, positive mindset makes any difference. And it certainly doesn't mean that people who don't find themselves in that position are not, doing the best that they can for themselves, or if only there can be a lot of very unfortunate language around cancer in terms of battling, in terms of fighting. Yeah. This does not make a difference scientifically. There is no proof to say that your own personal psychological approach makes a difference to your outcome. Obviously, it makes a difference to how you live your life and how you feel, and maybe managing some of the worst emotions. And so I had no scientific basis to say any of this. There was no reason to think that it was going to be better for me than anybody else. But that worked for me because I didn't find myself going down very negative rabbit holes. Obviously, I did sometimes. Obviously, there was times late at night where I'd be thinking, I can't believe that this is happening and that I'll be leaving my children behind. But for most of the time, day to day, I just took things, here I am now. I feel well now. I don't feel currently like I'm about to die. So there's no reason to worry about that at the moment. And that got me through, I think, the first couple of years when my children were so small. It was probably after that it actually got more challenging when I had a little bit more time to myself to think about things. So that was probably where I found that just thinking positive really wasn't enough to get me through.
And when you mentioned the mindset and the thinking positive, Were those skills that you had beforehand, or did you go and do some work on that?
I guess they were skills that I had but didn't realise at that time. I had always been a very big advocate for, I suppose, self-reflection and thinking a little bit about how our thoughts can impact our emotions and our feelings. And I would have been always involved in counselling and therapy. That was something that I was very comfortable with. I would have had, like everybody has ups and downs in my life before that. And I had accessed therapy. I'm always very open to that idea. I had initially been training in psychiatry, and we would have been exposed to psychotherapy in a training setting, and like that, it was something that interested me. So I suppose I'd already got some skills in terms of thinking about thoughts and realizing that we have some control over our mindset, our outlook. And then when I was diagnosed, I absolutely availed of the supports available through the cancer charities. So in Cork here, we have Ark House, and I was really lucky to be able to get psychological support and physical support and lots of lovely treatments and, lots of different things that were provided there. And I really benefited from that. I would have done mindfulness-based stress reduction course that was specifically designed for people living with advanced cancer. So I think that really was really helpful, the fact that it was really for people who are in this quite unique position. And that certainly, as I say, in that time when things had actually gotten better, but actually psychologically it was a little bit more challenging because you're dealing with uncertainty a little bit more, and you start to hope a little bit more in terms of maybe I might be alive in 5 years' time, maybe I might be alive in 10 years' time. And then you find yourself catching yourself to say, well, that's not statistically likely, even though I want it to be true. So those were the most challenging times. And as I say, that's when skills that I had, I suppose, been lucky enough to learn along the way really did help me to try and come out of those times when I would find myself beginning to really spiral into maybe, as I say, a hopeless or negative space, which again doesn't suit me.
Yeah.
For some people, it's important for them to experience their negative emotions more or a little bit more fully. But always I've been a person who is much happier when we're looking at things with an optimistic lens. That is what just suits my personality.
And do you think so in the days and the months after the diagnosis and right up to now, do you think those mindset skills have helped you and how you approach life overall?
I think they have. And again, I do feel that is very personal. I think that they have worked for me, and I have been able to reflect on the times where I've been able to feel, quite strong or quite in control of what's happening for me. And again, that has been the time maybe when I've had to put in that little bit of effort in terms of really, setting my expectations of myself. And, thinking about, am I talking myself into a situation that isn't going to work for me? Or am I able to bring myself a little bit beyond that? And as I say, to have those maybe goals and aspirations, which are very difficult words to talk about when you have a life-limiting disease. It's not the same, I don't think, when you have this notion of an endless life in front of you, which we all have, in that none of us has an endless life in front of us. So we're all in the same position, but when it's a little bit starker for you, or when it's a reminder all the time that, again, as I say, statistically, my life will be shorter than other people, I suppose it condenses your need to really try and build strength. I'm not a huge fan of the word resilience. At the same time, I can see that sometimes that would be what people would apply for the kind of circumstances that I've been in, where I've been able to maintain a reasonably positive outlook. I've also I guess, done a number of things, as in I set up an organisation for female doctors and medical students just after my active treatment finished. And really, while that was something that was very important for female doctors and medical students, and there are similar organisations in a number of countries around the world, and that's where I got the idea from. It wasn't my own idea. But on a selfish basis or on a personal basis, it helped me to be thinking about something else, about doing something else. Potentially you might call it a greater good or something that was outside of myself. And again, for me personally, that helped hugely. It was a distraction. It was a motivator, and it was something that was completely unrelated to cancer or treatment or my health. It was to do with, a much bigger group of people than myself.
Yeah. I found it really interesting when you said that you don't love the word resilience, and you strike me as a very resilient person. Just tell me a little bit more about that, about the dislike around the word resilience.
That really, I suppose, comes from working in a healthcare environment where the word resilience has been brought in recent years in terms of supporting people to become more resilient, resilience training. And I guess what we would say when we're working in a dysfunctional environment is that it's, you're asking the person to change and not the system. So the system does not support people working in it for a number of different reasons in terms of, workforce issues, the sort of level of respect that's paid to people working in it. And we all know, there's plenty of research in terms of occupational health and, occupational psychology, the things that make people feel happy in their workplace, feel supported, feel strong, feel, brave. And for many people working in the health service in Ireland, that isn't there. That environment is not the environment they're working in. So supporting people to be resilient by giving them a half-hour training session once every 6 months, as opposed to providing them with, the rest times that they need, or the, letting them know their roster more than a week in advance. Those kind of things will improve a person's work experience a lot more than resilience. So that's where my difficulty with, as an individual, for individuals, and describing somebody as resilient, I don't have as much problem with that. I still do think that is very much down to a person's environment, the luck that they have where they're born, their the advantages that they are bestowed upon them, and the societal injustices that are there will make it a lot harder for somebody to be, as I say, resilient, if you want to use that word, compared with somebody who really has, a lot of things already delivered to them by virtue of the luck of their birth.
Yeah, completely understand. Your diagnosis, did that ever define, do you think, your identity as a person?
It probably has become a part of my identity now, and that is because I talk about it. A lot of people will, the majority of people will choose to keep something like a cancer diagnosis, to themselves and to their family, which is absolutely, that's I guess the more expected thing, or that would be what would happen from most people. And then when I reflect on why was it that I decided to talk about my diagnosis publicly, and I've spoken with other people who do this, and we would talk about advocacy work, we would talk about breaking down barriers, breaking stigma, allowing other people the opportunity to either maybe think about, is this something that I need to be worried about, and maybe earlier diagnosis or screening, but also people who have been diagnosed, maybe to support them by saying, well, this person has had this type of treatment and this is how she's getting on with it. So obviously there are, on the face of it, quite a lot of altruistic reasons why somebody might open up about their own diagnosis. But again, reflecting, a lot of that is a little bit about, I suppose, wanting people to say, aren't you great? And, well done you, and, isn't she marvellous? So, I have to accept that there's a little bit of that. There's a little bit of the, potentially ego massaging in that. I speak to groups of people, to audiences about lots of different things, you know, about professional things, about medical things, about my work for women in medicine. And yet, as soon as I'd say something at all related to my own cancer, you know, you'll always get a very different response from the audience. If you think the audience isn't going your way, you can always pull the cancer card out of the bag and literally nobody will complain or give out to you. And that is, you know, that's like a talisman, you know, or a protection, which, you know, I'm admitting that I would use that. And in a way, I don't really have any shame about that, because that is society's response to cancer. If I said that I had peripheral vascular disease, which is, you know, like a cardiovascular disease, a problem with the circulation, we'd say, in your legs, or if I had, you know, some kind of heart disease, which could absolutely kill me tomorrow, I would get, you know, a minute amount of the sympathy compared to if I say that I have cancer. You get the, you know, variation between what I call the head tilters, so people who will automatically tilt their head and go, oh my God, aren't you marvellous? And then you'll get the, you know, people who are almost find it empowering or sharing the empowerment. And so it is a funny one. There's you can't say to somebody you have cancer without there being quite a significant reaction from them. And so the question was about, does that identify me? It has become my identity because it has created this narrative around me that wouldn't be there. I could still have the same cancer, I could still be doing the same treatment. If I didn't go on about it, people wouldn't identify me with being that person. They wouldn't think about me in the same way, even though I am the same person. So it's a curious one. It's a little bit like, is the you know, when a tree falls in the woods, can you hear it? If people didn't know I had cancer, they would treat me differently.
Yeah. And so would you say that it has become your identity, or that it's just part of your identity? Because when you look at what you've achieved, you're a mum, you're a doctor, how do those parts still feed into your identity? Are they you, or who is Sarah?
Absolutely. I think that all of those, you know, for any of us, our identity comes from all those different aspects of us. And it depends also on any given day, you know, depends on what I'm about on any given day. You know, sometimes I'm very much about being a doctor. Sometimes I don't want to be a doctor at all. Sometimes I'm on holidays or I'm somewhere and the last thing I want is to be a doctor. I couldn't possibly say the same thing about being a mother, because obviously we all know that every single day that we're mothers, we love every last second of it, and there isn't a single moment where we lock ourselves in the toilet. That would never happen, has never happened in my life.
Forgiven.
So yeah, I think it really does depend. I'd say that, and again, for all of us with all our different identities, each one of them can be draining in their own way. And so I think it is lovely. I'm really lucky to have lots of different aspects or lots of different parts of me, and that has definitely been something that I have benefited from. Previous to my diagnosis, I was probably, you know, a doctor and a mum. They were probably my two main strengths or my two main identities. And since then, I've developed a number more. Obviously, having cancer is one of them, but lots of other things as well. And that does come as well. When your life expectancy is short, you're much more likely to say, yeah, I'll do that in 18 months' time. Or certainly I did, because at the back of my head, I said, well, I can say I will do this in 18 months' time. You know, they're not going to dig me out of the ground to do it. So I'm either going to be there or I'm not. So it felt much freer to be able to say, absolutely no problem, I will go speak at a conference, or I'll, you know, do something that would be challenging for me usually. But in my head, there was a 50-50 chance that I wouldn't have to do it. So I said, yeah, why not?
That use of the word freeing there I find really interesting, because I'm not sure I've ever heard anybody describe a stage 4 diagnosis with the word freeing. Now, I'm sure you wouldn't apply that to all areas of your life, but just talk to me a bit more about how it may have been freeing.
think there's, first of all, the idea, and again, a lot of people with life-limiting disease would talk about the fact that you're making the most of every day.
Yeah.
So, that idea of I'm going to go on that holiday that I've always spoken about, or I'm going to go dye my hair pink, or I'm going to do something, drastic that I thought about I might do one day, but I'm realizing that I only have a certain number of one days left.
Yeah.
So there's that liberation from that point of view. And then, as I say, there is that other aspect of, for me, losing any sense of I couldn't do that now because people might think one way or the other about me. I was thinking, well, I'm already in a fairly bad situation here. The only, the main thing that matters to me is obviously my children and my family.
Yeah.
But outside of that, in terms of me personally, I don't really care if people see me standing up in front of a crowd and my voice is shaking, or I suppose I was lucky enough that for me, appearance had never been something that was what gave me kind of personal value. But at the same time, when my skin and my hair and things like that are affected by chemotherapy, I'm like, well, I'm not really going to care about that. This is keeping me alive.
Yeah.
This is important for me to be here for my family, for the things that I love. So you're and again, I would have heard plenty of other people with cancer and other diseases, your giving a shit list goes quite low at that point. You really don't care about much except those core important relationships that you have.
Do you think, Sarah, that your medical training has helped with your mindset in facing what you're facing?
I think that's a really tricky question.
Yeah.
Because I could never have been something else. It's not like there's another Sarah who wasn't a doctor who got exactly the same diagnosis and that we could compare the two. Yeah. I think that, and people often ask the question about, does being a doctor make a difference in terms of being a patient? Is it harder? Is it easier? Is it good to know more? Is it bad to know more? And there is no black and white answer to that. And I've written a little bit about this because it is quite fascinating. And in terms of myself, when you're a doctor, you learn to not get much sleep. You learn to put up with quite significant physical difficulties, feeling exhausted, not being able to eat, not being able to go to the bathroom, kind of these kinds of things. Like, it is quite physically grueling. And maybe that's, a benefit to me when I'm going through difficult treatments, that my body has already had quite a lot of experience of surviving difficult physical circumstances. I think, though, realistically, everybody's experience is very different as a doctor, as a cancer patient. And I think that, I do think that being a patient has informed my understanding as a doctor from that perspective. I don't think that every doctor needs to be a patient in order to be a better doctor. I don't think that, I am a better doctor than somebody else because I've had lots and lots of healthcare experience. I do think, though, that I have a little bit more, slightly more empathy than I would have had in the years coming up to my diagnosis, because I was at the busiest part of my life and probably my empathy levels were drifting a little bit, as happens to all healthcare professionals at some point in their life. And the thing that I talk about a lot in terms of what matters to me the most as a patient is that I understand the value of kindness in healthcare a lot more than I used to. Kindness isn't something that we speak about in our training as an entity in itself. Obviously, we talk about lots of different things about making sure that people are comfortable and having good communication skills and helping people to feel comfortable in both in the conversations that we have, but we'd say in procedures that we do. We do focus as much as we can on the person's experience, but that is often goal focused or action focused or outcome focused. Whereas just the simple act of being kind, it doesn't have to have an outcome. You don't have to be getting the blood test. You don't have to have the prescription written. But just sitting with a person and being kind has a therapeutic value that I definitely underestimated or didn't even contemplate until it happened for me. Because because of the way the health system is, they're relatively rare. They're not. You probably have a moment of kindness every day when you're in a hospital, so it's not like it doesn't happen at all. But of your 24 hours, it might be 2 or 3 moments, but they are absolutely the gold dust of the day when you are a patient. And all of the other bits and pieces are really important, and they keep you alive, and the blood transfusion and the, whatever else that is going on. But just the little, chat while you're in the wheelchair being pushed down to the X-ray department, or while your, tray has been taken away, or any of those kinds of things. And you really feel it where it matters.
Yeah, that's so true. A little moment of connection, it can just lift somebody out of somewhere.
Yeah, exactly.
Yeah. And so tell me, Sarah, what do you do for yourself when your mind goes into a place of maybe somewhere you don't want it to go? What do you do to lift yourself out of that?
I've found over the years that the most effective thing is for me to write. I would have tried lots of different things. As I say, I mentioned the mindfulness-based stress reduction. I'm a big fan of getting out walking, getting out into into nature, and those things definitely help. And I try and build all of those things into what I'm doing. But really, the thing that really helps me to move on when I have a sort of block, or I find myself like that, beginning to get caged in a little bit by negativity. That if I just write out my thoughts, and sometimes that means sitting on a train or in the passenger seat in the car and writing little notes in my notes app on my phone, and just letting out the thoughts. And for me, it's probably more, I would probably be leaning more towards the frustration, cross anger type negative emotions, rather than, we'll say, low mood or emptiness. Certainly I've been there, but I do know that one of my initial reactions to things can be, frustration and giving out. And so if I give out to the page, that's the best place to do it. Yeah. And then afterwards I find that the person or the thing or the situation that I thought I was giving out to was mostly in my own head, was structured out of a number of different things that were coming together, and I was focusing all of this anger on one thing, whereas obviously was to do with hundreds of other different things.
So would you say, Sarah, that your strong mindset, if I can describe it as that's what it sounds like to me, do you think that has helped you deal with life challenges?
I think it probably has, and again, I can't really pinpoint where it came from. Certainly, I'm very fortunate to have fantastic family and parents who would have been a really good, wonderful influence in terms of dealing with adversity. And I do think that it has been able to bring me along the way. Obviously, medicine and science and research has kept me alive. I mean, I'm really lucky that I'm coming up to 11 years after a diagnosis that, as I say, that had a prognosis of 15 months. And that is all down to science. For me to be able to live my life as well as I can live it, or I feel that I have lived it reasonably well in the last 11 years, I think has been down to having a focus on trying to get the best out of myself psychologically, or trying to get the best out of myself in terms of what I can bring. I think that absolutely understandably, when people get a cancer diagnosis, there can be a significant amount of what I would see as the most negative emotions in terms of shame, blame, guilt, regret. I can't handle any of those emotions. I really lose it when I find myself going into those zones.
Okay.
And yet they would be reasonably common for people who are diagnosed with cancer, that they will say, well, how did this happen to me? What did I do? What have I done? I should have done this differently. Somebody else should have done this differently. Somebody else, caused this. And I have seen it in people that I've met over the years. People talk about cancer as something that eats you up. it eats you up from the inside. But actually, I think it's those emotions, in my experience, tend to eat people up even more. And a lot of people have difficulty recognizing them within themselves. And they almost think they're normal because the discourse can be around that. I could say to somebody, I have cancer. Somebody could say to me, how did you get cancer when you were so young? I could hear that as being, what did you do to get cancer? What's wrong with you? Did somebody not know that you had it? Couldn't somebody else have prevented it? Why didn't the doctors save you? And yet for me, I would see, if somebody said to me, how did you get cancer? I said, well, sometimes these things happen. It's, it's really unlucky. But actually at the same time, this number, however many hundred of people a year under the age of 50 do get bowel cancer. That's what happens. Lots of people have extremely negative things happen in their lives. And, it's extremely rare that they are the entire reason that it happened.
And Sarah, what would you say to somebody in your position or facing the possibility of death? Not the possibility, but I suppose the more definite.
I think we are all naturally scared of death. Some of us are terrified of it. Some of us will automatically, we all, I imagine, will think about what will it mean for people that I leave behind. And that is definitely the most difficult conversation or the most difficult thoughts to have. And a lot of people aren't sure of what it's like when you come close to the end of your life. And that terrifies them. So a lot of people have never seen somebody die. And I understand I'm using the word die quite a lot. And in Ireland, people find that very difficult. We talk about passed away, lost. It is quite confronting for people to use the word death and dying. And that is the language that I use. But I understand that can be a little bit confronting or difficult for people. But I think that comes back again a little bit to our terror, our fear around dying, that sometimes we can't even say the word. And I think it can be really helpful. There's an excellent book by a doctor called Catherine Mannix. She has written a number of books, but she's a palliative care doctor in England, and she has written quite in detail about what happens when you come to the end of your life. And the reason that she's written that, and these are from experiences that she's had with families that she's worked with, the reason she's done that is because she knows how many people she's spoken to, and their loved one is unwell, they're in a hospice, and the relative, the person that's with the dying patient is absolutely terrified about what's going to happen next and has no clue. And yet when she talks about it and she speaks about it in a really empathetic, really understanding way, obviously this is her life's work, and she says that once you explain to people what dying is like, that actually it becomes much less frightening. So we have, shelves and shelves and shelves of books about pregnancy, about childbirth, about, children coming into the world, all of those things, what you need to do, and you have your birth plan, and you have your soft music, and you have your special cushion, and you have all of this, and we don't do that for dying.
No.
And there is huge benefit for us to be able to say, actually, I want to think about how my death is going to be. We all will die, and yet we all struggle endlessly with the thought of it. Whereas, like with a lot of things, taking on the knowledge, informing yourself, really having quite significant thoughts about it. And it's in the same way that you might do about, I really want a water birth, it's something that's really important for me. But also thinking about, well, where would I like to die? We know that most people, when asked where they would like to die, a lot of people will say that they'd like to die at home. And we know that most people die either in a hospital or a hospice setting. So the majority of people will die in a hospital setting. And the main reason for that is that when they were asked the question, where would you like to die? They'd say in their head, I'd like to die at home, or they say it to the researcher, the person asking the question. But they don't say it to their family. No. They don't say it to their doctors. And then when it comes to it, there's always this question about, I don't want to be a burden and I couldn't possibly do that to you. But again, if we have a little bit of planning in it, obviously we can't predict our death. It's not the same as a baby being born, in that you have a reasonable idea of when this baby will be born once the person is pregnant. But we will die. So even though we can't predict the date, it is going to happen. And if we set aside a few minutes to just have a little think about what that might be for us, how we might like it. Funeral planning is actually a really entertaining thing to do. Think about your funeral playlist. Something that I would have thought about before I was ever diagnosed with a terminal illness. Because I love parties, I love events, I love, dancing, I love music. So why wouldn't I think about what I would like people to be listening to as I go into the crematorium or whatever. And so it can veer from, sort of humorous or enjoyable things like that to obviously the very, very serious. But what I would recommend is the Irish Hospice Foundation have a document called Think Ahead or Thinking Ahead. I always forget, but if you Google it, so Think Ahead, and it is a document that you can print off, or that you can, I think there's a small fee to have it sent to you. And within that, you can write down a lot of things about your wishes in terms of medical wishes. So this would be maybe for people, thinking about, would I like CPR or cardiopulmonary resuscitation? So the idea of somebody pounding on your chest or being intubated. So people would be familiar with thinking about those kinds of things, turning off the machine, as it might be called. But it also has a lovely section about how you would like your funeral to be. Are there people that you would like somebody to contact? So any of us who've had the experience of close relatives dying and being involved in funeral arrangements, there'll always be somebody who say, oh, remember that person that was her neighbour when she was younger, but I can't remember her name, and maybe she would like to know, but actually we have no contact details. So within this Think Ahead form, there's a little bit where you can say, I'd like my neighbours from when I lived in Waterford to be informed, or small little things. It can be anything. And again, I think that that's really helpful for people to just get a little bit closer to being more comfortable with dying a death. And I know that it's very difficult, and the way I am about it is pretty extreme compared with the maybe most people's experience. And as I say, most people haven't been very, very close to haven't seen somebody, for example, die in their presence. And so therefore, I realise that my personal experience is quite different, and which has coloured how I am about it. But I would encourage people to just think about it a little bit more. As I say, the Think Ahead forum or Catherine Mannix's writings about it, I would strongly recommend.
Yeah, I think that's really, really good advice. Thank you so much, Sarah. It's been an honour and a joy to talk to you. Really life affirming.
Oh, thank you. That's very kind. Thank you.
That's it for this week. If you've been affected by anything discussed in this episode, please do seek help. Have a look at the Irish Cancer Society or the Irish Hospice Foundation's websites. Next week, I'm joined by Jack Kavanagh. Jack has only 15% muscle function, but rather than allowing that define his limits, he redefined what's possible.